overdiagnosed in 21st century. Yes. We have well-researched, I'm not talking about some stories, some strange stories. We have a scientific approach to problem of toxic stress and adversity. I'm not in the story with my child, but I'm in the story with my ex-partner. Never-ending story. Not only apparently alienation, but also abused and neglected child have symptoms of ADHD, but this is not genuine ADHD or ADD. You have to analyze all the factors, not only behavior, but also family. These children have a terrible situation in their home, 24 hours, 7 days per week, the whole year, 1 year, 2 years, 3 years. The most important thing is to recognize it just in time, that a child has some problems. Soft signs could be a red flag, with concentration, with restless leg, with food intake, with obesity, with peers, with friends, some kind of anxiety, hyperactivity, to ask ourselves and to ask parents if there are some problems. I'm not sure. I noticed some changes in behavior in your children. Ask parents. Everyone who works with children, in kindergartens too. If we recognize it and start with therapy, it is not a destiny. I want to hear, to see every little sign and make a mosaic, to see a clear picture. When I see a clear picture of ADHD, I make a diagnosis. But I'm not sure when I have some strange feeling, when I see these children who don't have these symptoms only on the paper, but those children come to me and hug me. They need love. They are starving for love, for attention, because their situation in their homes is not good, especially in high conflict divorces. I think that is very important to thinking about attachment. Only one person who will manage all problems with children. If children lose a ball, mobile phone, have some conflicts with peers, will come to this person and tell, I have a problem. This is attachment, secure attachment. But in cases of high conflict divorce, children don't know who is secure person for him or her. We need some more experience and some more investigation about resilience. Only 10 to 15% children have a resilience from toxic atmosphere. Toxic stress leads to very soft inflammation in blood vessels. Some of them will carry their problems during all their lives. That's why we are talking about long-term consequences of toxic stress, about heart attack in 30s, This is a long-term process. It's all about stress hormones, hypothalamus, adrenaline, release adrenaline, cortisol, stress hormones, step by step by step by step. And for those with AC4 or more, the risk for heart disease is 3.6 times higher than the control group in other population, but not in correlation with smoking, metabolic syndrome, obesity, high blood pressure, etc. Also, the problem with immunological system, diabetes type 2, some kind of cancer. Toxic stress change the way how DNA read and transcribed. It's all about biology. Some environment could activate some genes, such as gene for cancer, for lung cancer, for breast cancer, etc., and for immunological disease and other disease. In most cases, when we turn around and see that those mothers was from high conflict divorces, was also a victims when they was 5, 6 years old. That's why we are talking about of transgenerational scale of toxic stress. The vertical transmission from parent to children, from generation to generation. All my friends knows that I'm talking about toxic stress all the time. They talk to their friends talk to their we need to sensibilize our society for a problem of toxic stress. When we know that toxic stress leads to health problems, to social problems, to psychological problems, and even to economic problems, we want to upgrade quality of child time. That's why we are trying to do it better. We couldn't make decisions like in 19th century, because today we know such a lot of things, we have experience, we have to do better and much more for children. Also because of us. When we retired, what quality of population will have? Parental alienation is so complex. I'm not sure that is only one diagnosis. That is maybe 10 diagnoses in one. I think that is matter to recognize it and to minimize all these factors, complex factors. And then parental alienation will be smaller and smaller portion of high conflict divorces. This is a long-term process. This is not one-day surgery. We have rising cases of high conflict divorces from year to year. Yeah, about 15% rises every year. On 4 million inhabitants in Croatia, last year was 7,000 divorces. 30% is high conflict. And if every family have 1 or 2 children, maybe 6,000 new children from high conflict divorces, very high conflict divorces every year in a small country. 5 years ago, I don't think I have enough knowledge But today, I can say, I see this picture completely clear. And believe me, I know what I'm talking about.